The country has suffered from the burden of non-communicable diseases amid worrying statistics of fatalities resulting from such ailments. The four main types of non-communicable diseases prevalent in the country are cardiovascular diseases like heart attacks and stroke, cancer and diabetes. It is a state of affairs that formed the basis of discussion at the ongoing Second Universal Health Conference in Nyeri, with participants calling on the government to declare the non-communicable diseases a national disaster. Amref Health Africa Country Director Dr. Meshack Ndirangu calling on urgent mitigation mechanisms, saying up to 70% of deaths in Africa could be from non-communicable diseases by 2020.
Communicable diseases contribute to about a third of all deaths in Kenya, whether in hospital or outside hospital. And what I would like to note is that close to a quarter of these deaths are happening from Kenyans of all walks of life below the age of 40. And now, with 40% or almost 20 million of Kenyans' population being between the age of 18 and 35.
Nyeri Deputy County Boss Caroline Karugu painting a grim picture of the county statistics. Speaking at the same forum, Kisumu Governor Professor Anyang' Nyong'o called for the transformation of NHIF to a health fund from its current state of a hospital fund, as most of the people who depend on the insurance are outpatients.
Medical services have proposed that we should transform NHIF from being a hospital fund into a health fund, National Health Insurance Fund. I hope we can still do that, so that we don't confine it to hospital. You see, NHIF just talked about if you go to hospital and you are admitted, then we come in. I said no. 75% of Kenyans go to seek health services as outpatients.
Sentiments echoed by Makueni County Boss Professor Kivuta Kibwana, who called for the disbursement of funds to all 47 counties to fund programs aimed at enhancing enrollment of NHIF.
And we have seen, for example, the burden of NCDs and so on. It might be important for the national government to make funds available to the other 43 counties so that we can begin to do registration. We can begin to do a bit of infrastructure, equipment, planning, so that we don't have to wait until next year.